Hello, I'm Dr. Tanweer Ahmed. I'm one of the hybrid international emergency medicine trainee and associate member of Royal College of Emergency Medicine and World Academy of Medical Leadership. Currently posted in Emergency Department of Chitwan Medical College and Teaching Hospital. I would like to extend my warm welcome to this video presentation. My thesis topic is ECG findings in patients coming to the emergency department with organophosphate poisoning. I would like to tell you a story about Bechan, who is a 54-year-old male and a farmer by profession. Due to socio-economic burdens, he decided to end his life by taking poison, and he conveniently found the insecticide that he uses for his crops. He was brought to the emergency department by his wife. She said she found him lying on the floor. He was frothing from his mouth and profusely sweating. She also says he was confused. She found a bottle of poison beside him that was later identified as organophosphate. Organophosphate poisoning is one of the most common causes of poisoning worldwide. Nearly 3 million people visit emergency departments around the world for OP poisoning, and out of which 200,000 die with or without treatment. Organophosphates can be considered as esters of phosphoric acid with a central phosphate molecule and alkyl and aromatic substituents. They occur in a wide range of forms. Cardiovascular manifestations frequently accompany exposure to organophosphates, but their exact nature is not fully elucidated. Some of these complications can easily be detected early on with the use of ECG, which is an easy and readily available tool. If this information is acted upon in a timely manner, it can greatly reduce mortalities resulting from major cardiovascular events due to the OP poisoning.
The aim of this thesis is to find ECG changes in patients coming to the emergency department of CMCTH with OP poisoning. And these are my specific objectives.
The process mapping and the fishbone analysis shows where we can make improvements. This is our process mapping that goes on so far in the AD.
Current process map in the department. At the moment when the patient comes into the department, they start at triage, where the paramedic takes the triage vitals, and from there on the patient is triaged accordingly and is later assessed by medical officer, who takes a detailed history and does a clinical examination. After that, the further assessment and confirmation of OP poisoning is done by resident emergency medicine, and then relevant investigations are sent and the ITU team is informed and the patient is handed over.
This is our Ishikawa fishbone analysis, the problems that we may face leading to adverse cardiac events.
Limitation in the current process is explained further in the fishbone analysis.
And this is the change that we are going to implement.
Adding a standardized 12-lead ECG right after OP poisoning confirmation with proper reporting in the process map can affect outcomes positively. This is my Gantt chart spread over a duration over 4 years. The writing has already begun and I will focus on the data collection and analysis when I return back to Nepal in the 4th year of my training.
Ethical clearance will be taken from CMC IRC and QMET International. Clearance to proceed with the study will be taken from head of department. Participants will be selected through the inclusion and exclusion criteria. OP poisoning will be confirmed by history and clinical features. Written consent will be taken from the patient or the legally authorized representative in case if the patient is confused or unconscious. A 12-lead ECG will be done that is standardized at a paper speed of 25 millimeters per second and gain setting of 10 millimeters per millivolt right after confirmation of OP poisoning. Using a preformed proforma, data will be collected and analyzed in IBM SPSS version 20. Using the proforma, information will be collected and will be verified with the on-duty cardiology resident and nurses in charge for any missing data and peculiarities. Finding of the research will be submitted to QMET CMC IRC. Then it will be published in an indexed journal. With the help of Square guidelines, I will publish the result, and I aim to achieve a healthcare standard where patients coming to the emergency with OP poisoning benefit from timely intervention required to reduce cardiac events and death with the valuable information a simple ECG can provide. Thank you.